So right now, Canada is not scoring so well with respect to the rest of the world in terms of our healthcare outcomes. And the real challenge around that is the fact that we are really a hospital-based system when we really need to be focused much more on community and community-based health. There's huge areas for opportunities to tie in the powerful research that we have in the province, tie in the clinical strength and the system strength that we have all together into the ability to drive revolutions, I would say, in primary care that's going to drive better health outcomes for Albertans. One of the great things that's just happened, has been happening in the last couple of years in Alberta, is the fact that our companies have been doing really, really well in terms of raising venture capital. We hit another record year back in 2022, and this is really demonstrative of the kinds of innovations that we're developing here and their global relevance. So to answer your question shortly, jobs and growth in Alberta is what this is all about, because we're attracting investment into the province, and we are exporting our technology and innovations around the world. That can just scale, and it's going to be a huge GDP contributor for the province of Alberta. One of the things that most of us know already is just the size of our healthcare system. Our regional health authority, Alberta Health Services, covers 4.5 million people, and that's a diverse set of 4.5 million people. You tie that now with the power of our research-based institutions that we have, along with the data assets that we have in this province, we have a real powerhouse to be able to transform healthcare. One of them is we tend to be a little bit too conservative in how we look at innovations. And so we need to separate out innovations from procurement and look at a new way of bringing in innovative technologies, testing and trying them and scaling them. That requires a couple of things, a little bit of a culture change to be able to take more risks that are still safe for individuals, but take more risks within the system. And then secondly, we might actually need you to look at some policy changes around how we address innovation within the province. For me, and it was more surprising than I thought it would be, is just the caliber and amount of innovations that are coming out of this province. We have companies that are globally competitive, all the way from digital health to molecular diagnostics to novel new therapeutic areas. And all of these are not only changing the way we do healthcare in Alberta and Canada, but they are changing around the world.